So good afternoon and thank you for attending this embargoed virtual press briefing on the impact of COVID-19 crisis on workers in the informal economy. My name is Rosalind Yard. I'm the Chief of News and Media at the ILO. And with us today, we have Philippe Marcadon, the Chief of the ILO's In-Work branch, Florence Bonnet, Labour Market and Informal Economy Specialist, Claire Hobden, Domestic Workers Specialist, Nuno Cunha, Social Protection Specialist based in Bangkok, Anna-Marie Chiaga, Informal Economy Specialist based in Harare, and Elva Morello, Inclusive Labour Market Specialist based in Buenos Aires. You'll find their names in the media advisory we sent you yesterday, and you should also have already received the press release and background documents that we sent you. Please make sure that your media outlet is added to your names in the participants list, and all journalists' mics will be muted and controlled by our technician. Raise the hand icon to indicate that you have a question.
Phenomenon. In some part of the world, if we stick to the number, decide to be a little provocative, we could say that formality is what is marginal. Informal employment represents, for example, 89% of employment in sub-Saharan Africa, 88% in Southern Asia. In the world, 2 billion people work in the informal economy. It means 6 out of 10 workers. The informal economy exists in all regions, but is more prevalent in lower middle income and low income countries. So we are speaking about big numbers. For people, informality translates in high exposure to most pronounced decent work deficit and poverty. Most of the informal economy workers have no social protection and a high income insecurity. They are twice likely as formal workers to be poor. And for the enterprises, same picture. Out of 10 enterprises that exist in the world, 8 are informal. They are mainly unregistered, small-scale economic units with low productivity, low earning, low rates of saving and investment. This characteristic makes them particularly vulnerable to economic shocks. We should not be confused. The vulnerability and poverty in the informal economy were there before the current crisis. COVID-19 crisis is a new risk that increased to the prevailing poverty and vulnerability. At the end of April, we estimated that lockdown measures significantly impacted 1.6 billion workers in the informal economy. Women are overrepresented in high-risk sector, 42% women, 32% men. Among these workers are the most vulnerable, such as street vendors, motorcycle taxi driver, hairdressers, the so-called necessity entrepreneur with no social protection and working condition. But the economic impact of the crisis goes beyond lockdown measures applied in one particular country. For example, some countries are facing drastic reduction in tourism that affects strongly the informals that are very present in tourism sector, reduction in global demand for external economy due to restriction in activity in other countries. Many informal economy workers, including business owners, need to earn an income to feed themselves and their family, as most of them cannot rely on income replacement or saving. Assuming a situation without any alternative income source, lost labor income will result in an increased relative poverty for informal workers of 34 percentage points. It means duplicating the level of relative poverty. For many, no works mean no income. Contagion or starvation is a dilemma of people in the informal economy. Even if they stay at home, many of these workers and their families remain exposed to the virus because of overcrowded and unsanitary living conditions that make physical distancing nearly impossible. In the informal economy, you cannot dissociate the health and economic dimension of the crisis. Without income support, lockdown measure cannot be implemented successfully with this endangering government effort to protect the population and fight the pandemic. If people in the informal economy get sick, Most of them are not covered by Social Security. This means many will be forced to go into debt or to sell their productive assets to pay for healthcare, plunging them even more deeply in poverty. Many will not be able to get access to healthcare. That's it. In addition to possible dramatic consequences for themselves, this will contribute to the spread of the virus. Measures to contain the propagation of COVID-19 are also likely to lead to an immediate loss of revenue for informal enterprise. Most owners may have to close their business temporarily or permanently as they have to sell productive assets to survive, leading to job losses and a surge in poverty. Basically, we describe in the brief that we just published that immediate responses for the informal economy can follow a multi-track strategy. First, reducing exposure of workers and their family to the virus and risk of contagion. Two, ensuring those infected have access to healthcare. Three, providing income and food support to individuals and their family to compensate loss of reduction of economic activities. Fourth, reducing and preventing the damage on the economic fabric and preserving employment. And all this is not going, if you don't take specific measures, because these people are not rich in most of the case by traditional public policies. COVID-19, concluding remarks, would say that COVID-19 once again spotlights the challenges associated with the informal economy and the vulnerability of the millions who earn livelihood there. It serves as a reminder of the crucial need to make transition from informal to the formal economy a priority area in national policy agenda. The transition from the informal economy to the formal economy recommendation number 204 remains a relevant tool in that regard. Thank you. Rosaline, this is you.
Thank you very much, Philippe. So we will take our first question from Antonio Broto from EFE.
Hello, can you hear me?
We can hear you.
Okay, thank you. Thanks for the report and the information. And I would like to have some comments on the situation of Latin America. According to the report, could be the most affected region in relative numbers. Even 90% of the informal workers there could be in relative poverty. And if you may, can give us some examples of countries in Latin America that could be especially affected by this crisis? Thank you very much.
Okay, perhaps Elva Morello from Buenos Aires may be able to answer that question, and some of the other experts as well will pitch in.
Thank you for your question, and I will answer regarding what, in our opinion, makes Latin America more vulnerable to this crisis, and then maybe in terms of figures, my colleague Florence can provide you more information. But what's different in Latin America from other regions is, first of all, the composition of the informal employment. The highest percentage of informal workers in Latin America are employees in the formal sector. And this is important to take into account also to think about the policy measures that we should implement to reach them. And then the highest percentage of informal workers in domestic worker sector is also something important to take into account. It highlights the importance of the sector in the region, and this high percentage of domestic workers are mostly women. So second issue that we need to take into account in the region is the gender dimension of informality. Informality affects women more than men in the region, and women are overrepresented in the sectors most affected and where informality is higher. And a third issue that I think is important to take into account in the case of Latin America is what we can call some geographical aspects. In Latin America, we have big countries. We have countries such as Brazil, Argentina, or Mexico, where people live in remote areas that are difficult to reach. And then this also relates to another issue, that is the high percentage of indigenous population that we also need to take into account when we think about the vulnerabilities that they face and about the policies that we can implement to reach indigenous people, that they need to be very specific to be effective in that case. And last point, but not least, I think we also need to take into account some administrative barriers that we face in the region. In the region, we still have an important digital gap. And when we are thinking about some of the measures that we are implemented in the current context, we are thinking of using technology because the social distance the lockdowns and the social the measures to avoid contagion makes us to think about some policies that can use technology to reach all beneficiaries. But in the region, we still have important digital gaps that we need to take into account.
Thank you, Elva. Florence, did you want to add?
Yeah, in fact, I was looking at numbers to see what were the countries the most impacted in the region, both in terms of number of people impacted and also in terms of reduction of income. And actually, when we look at numbers, as Elva was saying, you have big countries, Argentina, Brazil, where actually we estimate that more than 95% of informal economy workers are impacted. And this for several reasons. First, that the biggest countries in the regions adopted lockdown measures. This is the case of Colombia, Argentina, Brazil, Ecuador, Bolivia, Honduras, Dominican Republic. And in all those countries, actually most of the informal, actually big share of informal economy workers are in the hardest hit sectors. That means that you have at least between 1/3 and 40% working in wholesale sectors, manufacturing, food and accommodation, and you have an additional 15 to 25% working in domestic workers, transport, and so on. That means those are the kind of sectors that are particularly impacted by lockdown measures and other measures to prevent the spread of the virus.
Thank you, Florence. I'll take the next question from Laurent Sierro from Swiss News.
Hi, can you hear me?
We can, Laurent.
Thanks. Can you estimate the number of formal workers that might have to become informal workers because of the impact of the crisis? And will that increase the share of informal workers in the total workforce in the different countries? Thank you.
Perhaps Philippe?
Yeah, I will reply to this point. So estimating the size, no, we are not capable to do it, frankly speaking. What we anticipate is effectively an increase in the size of the informal economy for several reasons. First is that formal enterprise may have to, small and micro enterprise will not be able to overcome the cost of formalization because formalization is a cost. You should pay social security, you should pay tax. You have benefit, but you have cost. So at the time, they will be under very strong pressure because their income will decrease. Many of them will shift to the informal economy, leading to a shift also to an increase in their informal employment. We also anticipate that part of the workforce, in particular women, will also be working in the informal economy to compensate the loss of income of formal workers. So we anticipate an increase of informality, but how much, frankly speaking, we don't know. Florence, maybe more.
No, I would have said the same, actually. We could start looking by harder state sectors, size of enterprises, but it would be very difficult to estimate a number. No.
Thank you, Florence. Thank you, Philippe. We'll take the next question from Catherine Fiancan-Bokonga.
Quelques francophones présents visiblement pour poser ma question en français. Je souhaiterais avoir quelques précisions, s'il vous plaît, sur le secteur informel, particulièrement sur le continent africain. Merci beaucoup.
Thank you, Catherine. We have Anna-Marie Kiaga, who should be able to answer your question on that one.
Thank you, Catherine. If I understand you correctly, you wanted to know the situation of informal economy, the impact on informal economy in Africa. I do not speak French, so can somebody translate that?
That's correct.
Okay. So I think I will let my colleague Florence give us some data, but I can tell you the trends of what we have observed. First of all, to follow up from what my colleague in Latin America actually identified, the composition of informal economy in Africa also determines the impact that we see. We have more people, we have more own account workers in Africa, self-employed, and that itself has determined some of the impact that we actually see. The loss of impact goes directly to households, because most of the households have some people who used to work on their own, on their own businesses in the informal economy. We also we see trends when we get a lot of information of those who are working in within the formal sector. For example, those who are working in formal markets, those who are working, whose work was linked to formal services like West picking. We also see a lot of impact on domestic workers, many of whom we have to identify between those who were live-in, who most of them actually during the the lockdowns, they had to stay home, and many of them are reporting they fear whether they'll come back. Those who were live-in have remained in the households. Those who were live-out, those who went to work on a daily basis, are the ones that have a fear of actually losing their jobs. A lot of impact on those who are trading across borders, and a lot of informal trade in Africa is cross-border trading. And we have seen a lot of impact on that, as well as the borders closed, and they could not bring in items, especially those that were not identified as essential for this period. So there are a number of sectors that have been impacted. Mining is another one. Artisanal mining is another sector that is reporting a lot of impact on its members because of the close downs. Tourism, no question about that. There is a number of informal economy workers whose activities were linked to the formal sector, the formal tourism sector, especially those who are in transportation, from taxi drivers to actual hotel drivers. I mean, those who are supporting hotels. They've all been affected a lot in Africa as well. But also looking in Africa, we actually need to maybe differentiate from different regions, because we have countries that were more had a more formal economy, countries like South Africa, where the countries have quickly been able to come up with measures to limit the impact on the informal economy workers. Unlike other countries like Zimbabwe, where already there was a struggle. I mean, the economy was in recession, and therefore even the measures to support the informal economy, which is even more than 94% of workers in the country, are struggling to come up with better solutions. Having said that, let me ask Florence to help with the actual numbers of what we see happening in Africa.
I don't know if I have much to add to that, but actually, you said most of the main points that actually the majority of countries in Africa have an informality rate of more than 90%, which is quite enormous. And as well as Philip was saying in the beginning, informality is more the norm than others. And in Africa, actually, not so many countries that adopted full lockdown measures, but you have major ones like Nigeria, the Republic Democratic of Congo, which had an impact on the result in terms of people highly impacted. And it appears that outside agriculture, because still in Africa, agriculture is make a big part of employment, which is somehow considered as less affected, even though you have 500 million workers in agriculture that are estimated to be impacted by the crisis and lockdown measures. As Anna-Marie was saying, what makes really Africa specific is that you have a real majority of workers working on their own, or workers working in very small firms. It represents more than 90% of total employment there. And those are the ones that are mainly affected. And you have a lot of street vendors. You have to know that in Africa, for instance, you have 43% of all women working in wholesale retail trade outside agriculture, which is quite a lot, and they are the first to be affected by the current crisis. Actually, we are doing, and just to say a word, we are working in several countries in Africa to more precisely know what are the impact of the COVID-19, but also what could be the opportunities to support those workers and small enterprises to overcome the crisis and not to collapse and to be closed for on a definitively. So we are doing so in Senegal, Burkina Faso, and other countries, just trying to get the voice of workers, understanding better how they deal with the crisis and what could be the measures that really could support all those small enterprises and workers during this time.
Thank you, Florence. Catherine, is that a follow-up question that you have to your question?
I need some French for the voice, I mean recording. So, est-ce qu'il y a quelqu'un qui peut me faire une déclaration en français? Peut-être Monsieur Philippe, qui peut me donner un peu de son en français, s'il vous plaît, que je pourrais utiliser par la suite. Merci beaucoup, Monsieur Marcadan.
Oui, bonjour. Oui, Florence aurait pu le faire aussi parce qu'elle est francophone. Non, ce qu'on peut dire, c'est qu'en Afrique, comme l'ont dit mes collègues, il y a beaucoup de travailleurs et de travailleuses pour leur propre compte. C'est-à-dire, par exemple, chez les femmes, beaucoup d'activités qui sont commerce des rues, en zone urbaine, hein, commerce des rues, petit artisanat, préparation de nourriture. Et évidemment, quand il y a des restrictions comme les mesures pour contenir de confinement, comme il existe dans différentes parties du monde, ils sont parmi les plus affectés. Donc, ce qu'on essaye de faire actuellement du côté du BIT, c'est qu'on lance des formes de diagnostic rapide en utilisant différentes technologies, pour citer un nom d'une marque, WhatsApp, etc., directement contacter les travailleurs informels, essayer de comprendre vraiment comment eux, ils sont impactés, quel type de solutions pourraient fonctionner avec eux. C'est ce qu'on est en train de faire actuellement. C'est ce qu'on est en train de faire. Évidemment, comme on le dit beaucoup dans les papiers qu'on a produits, c'est-à-dire c'est très difficile. Par exemple, si vous êtes le gouvernement d'un pays francophone africain et vous décidez de mettre des mesures de confinement total en place, le problème, c'est comment les gens vont vivre, parce qu'ils n'ont pas d'épargne, ils n'ont pas de sources alternatives de revenus, ils ne sont pas protégés par la protection sociale, la plupart, donc ils n'ont rien. Donc pratiquement, ils vont travailler chaque jour pour gagner ce qu'ils vont manger le soir et nourrir les enfants. Donc si vous leur empêchez de faire ça, là vous avez un problème, un très très grave problème. Donc c'est très très difficile aussi pour les gouvernements africains d'appliquer des mesures de confinement total si vous ne donnez pas une alternative en termes de moyens de subsistance aux populations. Pratiquement, vous n'arrivez pas à le faire. Vous allez le faire et ça va générer des tensions, ça va aussi ne pas être respectés, ce qui fait que, évidemment, ce problème en Afrique est un problème dans ces pays-là. Hein, comme le disait Anna-Marie, il y a des pays qui sont beaucoup plus solides, qui ont des institutions qui marchent plus et l'informalité moins importante. Mais évidemment, le problème que vous avez dans ce pays francophone est un problème pour tous les pays du monde, parce qu'on parle d'un virus, on parle, donc si vous avez le virus dans un pays africain, vous avez le virus qui est susceptible d'infecter tous les pays du monde, les États-Unis, la France, etc. Donc je pense vraiment que ce qu'on espère, c'est que cette crise va débloquer aussi la volonté, par solidarité, mais aussi par propre intérêt des pays à coopérer et de donner à ces pays pauvres les moyens de lutter effectivement contre le virus, ce qui suppose d'offrir aux gens des alternatives en termes de revenus. Sans support en termes de revenus, ça sera pratiquement très, très difficile à appliquer. Voilà.
Could I build on this more positive message from Philippe? And I think, I mean, what we have observed a little bit in this region is that for many years there's a lot of talk on the informal economy, but it's kind of invisible, maybe when it comes to public policies, as Philippe mentioned. But we saw actually an understanding, and an understanding that we need to do something for them. Countries here, many countries took lockdown measures, and the country I live now, for instance, took some lockdown measures, not as restrictive as in other countries, but they also understood that they needed to ensure that people to stay at home, people, and especially those in the informal sector, need to have access to income, need to have access to social protection that usually they don't have in the traditional social security systems. And for instance, countries like Thailand, it was an amazing day. In 3 days, they were able to register 28 million workers out of a 38 million labor force. I mean, it's quite impressive. And until yesterday, they were already paying benefits that they will pay during 3 months, benefits to around 11 million workers. I mean, and I feel this is a game changer. I mean, for someone who works in the topic of social protection in the region, I've never received, and Vietnam announced measures. I mean, states in India are doing the same. Other went for universal benefits like Timor-Leste, covering everyone with less challenges in identifying. But I think that's also very important, is understand the reaction, I think the visibility that this group that usually is invisible for many public policies get during the crisis. And I think we need to build on this solidarity, because probably not all countries have this financial capacity to deal by themselves. And that's the linkage I would like to do with what Philippe said before. Thank you.
Thank you very much. And we'll take our next question from Jan Dirk Heberman.
Yes, good afternoon. In fact, I have 3 questions. My first one is, could you please tell us how many of the 1.6 billion informal economy workers have lost their jobs already? And secondly, you're saying that the relative poverty levels among the world's informal economy workers rise by as much as 56% in poor countries, and by 52 percentage points, sorry, in 56 percentage points in poor countries and 52 percentage points in high-income countries. What does that mean? That doesn't tell me anything, I'm afraid to say. And thirdly, in one of your paras, you say that the workers face an unsolvable dilemma to die from hunger or from the virus. The mortality rate of the virus is quite low. So can you elaborate on that? These in Africa, as far as I know, it's below 5%. So why do they face this dilemma to die from starvation or from the virus?
Thank you, Jan. Perhaps Philippe and then Florence.
Florence will speak about data, and myself I will speak about the last question. Florence first.
Go ahead, Florence.
So yeah, thank you for the question. No, we are not able to give the number of people who already lose their job Actually, it's really an estimate of those who are, as you say, some have lost their job already, but many have more reduction in their level of activities. And it's not possible for the time being to assess the number of job loss. For the proportion of increase in relative poverty, so actually, well, this is for the first month of the crisis. So, and this is about relative poverty. I don't know if it says something to you, but that means relative poverty is defined as all those people that earn less than 50% of the median earnings in the population. I hope you follow, but that means that relative poverty depends also on the distribution of earnings in the country. So what we have is we have the poverty, relative poverty calculated before the crisis, and then we assume, as I said, that some people are more impacted or significantly impacted than others. So depending on sectors, high-risk sectors, medium-risk sectors, and size of enterprises, in particular in small firms where we feel that they are most vulnerable to shock, we assume that the loss of income would be higher. So in terms of, when you have full lockdown, when you are in hard-risk sectors, and when you are in small firms. And coming to that, then poverty was recalculated, and we come to a 52 percentage point increase in relative poverty in high-income countries and 56 in low-income countries. And in high-income countries, the main reason for that is that many countries are in full lockdown. And actually, you have also many of those in the informal economy that are in hardest sectors, and many of them are part-time workers and low-skills workers. So that use, in any case, to earn less than what we could call the middle earner, the one with the median income. I'm not sure it was understandable, but tell me.
Okay. Thank you. And Philippe, could you answer the third part of Jan's question?
Yeah, sure. So first, I think, and this is a general feeling, when we have the discussion as we have today, we tend to focus on economic dimension of the crisis. But this is first a sanitary crisis. Many people, and most informal economy workers, have no guaranteed access to healthcare. So when we speak about informality rate, we are speaking on data based on country where people can access easily to health services and quality health services. In Africa, for example, many informal economy workers have no access to healthcare, particularly if you go for kind of reanimation or this type of high level complexity services. This simply is not accessible. So currently, unfortunately, it means the level of spread of the virus in Africa is low, but I am afraid, and I'm not only myself afraid, but many are afraid, including WHO, that if the pandemic effectively spread in Africa, the mortality will be very high. I think it's very important not to forget the health dimension. The health dimension is crucial. And as I said in my introductory remark, you have very strong relation between the economic crisis and the health crisis. Most people in Africa have no guaranteed access to healthcare. As Florence said, you have 65% people working in agriculture, in rural area. Health services are very scarce in most of the country, with few exceptions, particularly if you go to high level. And generally, for informal workers, they have to pay beginning by transport to go to the hospital and so on. After they have to pay to be received, and they have no money. A big share, for example, of child labor is related to the cost of paying healthcare. You have seen in one of the papers that 100 million people each year, 100 million people each year fall in poverty because of the cost of healthcare. It's enormous. Maybe Nuno, you want to complement?
Yeah, I was actually thinking about even in developed countries where we have, for instance, we saw the case of Singapore, where it was extremely successful in the beginning because they were able to put into the lockdown, but mostly they were measuring and following the cases under national citizens. But when they suddenly the focus in their attention focus on migrant workers, where the conditions of work are very similar. I would not call them informal workers in Singapore because it's a different situation, but workers with less access to health services, with less conditions in terms of accommodation, with less options to say, no, I cannot work. And I was talking today with a colleague, and we have seen already in some countries, some workers acting and refusing and using the right to refuse to work. But of course, this bargaining situation is not available for those in the informal sector. If you have a domestic worker that refuses to use a mask at home and the employer is telling them not to use, I mean, it's very difficult to observe because they are not protected by labor law. They are not protecting, like as Philippe said, by health insurance. They are in a very vulnerable situation, and this makes that the chance for them to protect themselves is very limited. And in my view, it's a question of equality. If I can be I mean, it's very easy. I've been at home for 2 months now, almost working with a nice computer in a nice room, but most of the people cannot afford to do this. They need to take risks. It's the people we see taking risks it's people in the construction sector, for instance. We see them still working with no masks when everyone in the same neighborhood is at home, but the poor worker in the construction sector is there. We see the domestic workers, we see the delivery men. It's everyone working in the informal economy. And I think it's a little bit unfair to look at this just in the logic of mortality, but why would then I have the chance to be protected, not that person? That's a little bit, I think, the logic we need to assess in these kind of situations. Thank you.
And to say also, in complement of what I said, when you look at the testimony of informal workers, many raise the duality between dying from the virus versus be angry in dying for having nothing to eat. This is not our interpretation. If you look at testimony, we have many. This duality is very present.
Perhaps I could just bring in Claire Hobden, the domestic workers specialist, because I think that this is an issue that has also come up in her research as well.
Yes, thank you, Rosalind. I think that the main issue has kind of been touched on, but essentially I think everyone in the world right now fears the possibility of contagion. And that is partly because there's a tremendous amount of uncertainty over how one can catch the disease and how bad the symptoms will be and what the risks, the mortality risks are. There's a huge amount of uncertainty for everybody. So we all have to deal with that. But the informal economy workers, as my colleagues have already made very clear, have the additional burden of fearing this alternative risk, which is hunger. Most of us are not put in that position, and that's more the dichotomy, the fear and the perception of the risk of these two different outcomes. In the case of domestic workers, we are also getting a lot of testimonies from them. And I think part of the issue is coming from the fact that they're sort of falling between the cracks of essential and non-essential workers. If they are required to go to work, there's very little information that's available on how to protect themselves. And for the most part, they don't have access to the personal protective equipment that they need to prevent contagion. They're also caring for people who tend to be vulnerable. So they'll either be caring for the elderly. And so there are countries like France, for example, that realized that domestic workers who are providing care services for the elderly are essential. And they've been given access to free personal protective equipment. But this is a very rare case. For the domestic workers who cannot go to work because of quarantine measures, for the most part, they have just lost their jobs and lost their income without any certainty about whether they will be able to go back to work after the quarantine measures are in place. There are a lot of individual employers who have taken it upon themselves to continue to pay their domestic workers, even though they're not working. But in these cases, the households themselves are not really getting any support from the governments to continue to pay those salaries. So what you have then as a result are a lot of domestic workers who are tempted to continue to work for their employers, having to negotiate with their employers whether they're going to come in or not, having to make this cost benefit analysis essentially of whether they would rather take the risk of maybe catching COVID on the way to work or staying home and not being able to put food on the table for their families. And in response to this, there are very few countries that have taken measures to include domestic workers in the emergency measures that are being taken, and even fewer countries that have extended those measures to domestic workers working in the informal employment arrangements. Argentina is really one of the only countries that we're aware of, and my colleague Elva can maybe say a bit more about that. But I do think on one last point, it's important to mention that the domestic workers organizations, their unions, have been mobilizing a lot to try to meet the needs of domestic workers. They have started delivering food to domestic workers and their families in need. They have been even making masks and distributing them to their members. They've been introducing legislation to try to include domestic workers in the emergency measures. And even employers' organizations in France and in Italy have advocated with the governments to make sure that the policies in place would ensure those employment relationships. So it's not easy for an employer, for a household, to find a domestic worker, and they want to maintain those relationships as well. So I think there's been a lot of positive response from the ILO's constituents on the ground. And I think that the key question going forward is whether or not these changes will be institutionalized in the long term, building on what my colleague Nuno was saying in terms of the government responses that we've been seeing recently.
Thank you very much, Claire. I think we'll move on to the next question because we only have 15 minutes left, and I see that we have quite a few blue hands up. So we'll move next to Lisa Schlein from VOA.
Hi, thanks, Rosalind. Hope you're well.
You too.
I have several questions. I'll be brief. If you've answered the first one already, I apologize, but how many of the estimated 2 billion informal workers who exist, will be out, are actually in Africa? The questions that I have actually have to do with Africa. And then the ILO has always considered domestic work as one of the more dangerous or abusive forms of work, I believe. What are some of the others that you find in Africa? And are you concerned that because of hunger, from lack of money, that many people might in fact expose themselves to more dangerous forms of work, not even for pay, but just for a scrap of bread or something to sustain themselves? And who are the most vulnerable in this case? And then do you have a figure on how much money the informal sector actually brings in globally? You know, what it is worth? Like there are all sorts of accountings made on the sort of money that migrants bring in and so forth. So I was wondering whether there was a comparable figure regarding in the informal sector. Sorry, and very lastly, and simply, could you sum up what would help people in the informal sector most? I know you say social protections, but is that even realistic? Thank you.
Thank you, Lisa. Perhaps we go first to Florence for the data.
Yes. Just to give the number in Africa, out of the 2 billion workers, actually 304, it's in English, 391 millions are in Africa, so not far from 400 millions. Those are the total number of informal economy workers, and in addition, among those almost 400 million workers, we estimated that 325 millions were highly impacted by the COVID-19. I think for the numbers, it was well, the size of informality in Africa. You were asking if we had an estimate of what the informal sector contribute to the economy. Actually, where some try to estimate what is the contribution to GDP of the informal sector. I can come back to you with some numbers. We don't have any global numbers, but in some countries it's as high as 30, 40 or or even more percent of global GDP, which is not so surprising when we see the number of informal economy workers and the proportion they represent in total employment. And even though labor productivity in the informal sector is at least 2 times lower than in the formal sector, but given the number, the contribution can be huge.
Thank you, Florence. Anna-Marie, would you be able to answer Lisa's question about the dangerous jobs, the types of jobs that maybe some informal workers may be forced to be doing because of the situation?
I will let Claire address the domestic work component of it, but the one sector that we see coming up increasingly is artisanal mining, because the work itself is dangerous. And right now, for example, in Zimbabwe, we have cases of people who actually tried to continue with their work even within, even during the lockdowns, taking that risk to do that. So now there's a big concern to make sure that artisanal mining is supported with occupational safety and health measures to improve the sector itself, and especially during this period. I would say that is the highest sector that we are looking at.
Thank you very much. Claire, did you want to add?
No, I think I understood the question was to ask about other sectors. So
okay.
May I add on the realistic element, on the social protection and the fiscal sustainability?
Go ahead.
Yeah, I mean, you mentioned the other elements than social protection, and you mentioned if it's realistic. I mean, we have been as ILO advocating for years about how affordable and necessary, and our point usually, what we try even more to demonstrate to our partners is that what is not affordable is not to have social protection in place. And I think this crisis has been showing that we cannot afford to have all this number of informal workers, means people without coverage. And it's interesting to see that usually, I mean, if we look historically, it's always after crisis that we have the big increases in coverage. For instance, the universal healthcare in China, universal pension coverage in China, this was achieved after 2008, after the crisis. I mean, we look at Thailand is the same. We look at countries like Timor-Leste, who is a low-income country. They have universal pension, and they are now looking at putting in place a universal benefit too. I mean, we have been seeing countries, I mean, also in Africa. I worked myself in Africa for more than 9 years. I mean, many times we did those calculations with governments, and probably now they will be looking at it in a different way. And the big question is, can we not afford 3% of GDP into social protection? We did some calculations, for instance, for Cambodia, very interesting calculations together with our colleagues from UNDP, and we compared the impact of putting money in the pockets of people, of poor people, versus the money that can go, for instance, for infrastructure, or money that goes, if you compare, even if you want to go further, when it's rescued to the banks and investments of that nature. But even the multiplier effect, if you put money on people, the way that they will spend in their own local economies, the multiplier effect, you are not only protecting people, but you are also protecting your economy when you put the money in the hands of those people who spend in their local spaces, in their local communities. And I think this is another very important message, is protecting people in the informal economy. Transferring income is also a way of protecting their own economies, especially economies who are extremely vulnerable from what is happening outside. They need maybe to use social protection also to change a little bit, to shift the economy to depend more on economic and domestic consumption. And I think that's what countries have been doing in this region, some countries already, and I think that's a shift that some countries are probably now thinking about. Thank you.
Thank you very much indeed.
I have time to complement quickly on 2-3 things.
Yes, go ahead. Yes.
No, I think first, social protection is very at the center of the response. As we say, you have a problem of access to healthcare services, and the cost of access to healthcare services. So this is really social protection. And you have income support. This is also social protection. In addition to that, you have several types of measures that I will not describe in detail. But you have trying first, if you implement lockdown measure in country where you have high informal economy, you should be very careful about communication, how you communicate with the people, how you involve informal economy organization in the design, in the measure, in their implementation, how you make them responsible. They are much better placed than in many countries and public authority to reach people. You have also everything that is about occupational safety and health in the workplace. So here again, things can be done. For example, survey shows that informal economy workers are not very well aware, but they don't know very well the virus, the condition of contagion. They don't know the symptoms of the virus. So it shows that they are sick, they don't know that they are sick, and so on. So having communication material able to be understood by informal economy workers, many of them being illiterate, many of them not being the official languages. So this is very important, and this is not so costly. Developing particular occupation-based guidelines, for example, for street vendors, for taxi drivers, these kind of things can be done. And obviously, in complement to what Nuno said, because effectively, as I said in the introduction, 8 enterprises among 10 are informal. So boosting, giving money to the people helps them to buy and to consume. And this also has good implication for the economy. But you can support directly informal enterprise with financial support, grants, restricting costs, making them not obliged to pay electricity and things like that. So we have a set of measures that we propose in one of our documents. I will stop here because I'm not close. But really, we should, and I think countries want to act.
Thank you very much, Philippe. We'll just go to Agnes, the next question. We do have 5 questions in all so far. So we're going to try and get through all of them, but if we can just be brief. So Agnes, can you go ahead with your question? Agnes is from AFP.
Oui, allô, bonjour, est-ce que vous m'entendez?
Oui, vas-y.
Ma question est très brève, très simple. Le premier paragraphe du communiqué dit que les mesures de confinement vont menacent d'accroître les niveaux de pauvreté des travailleurs de l'économie informelle dans le monde jusqu'à 56 points de pourcentage dans les pays à faible revenu. Combien de travailleurs informels se trouvent actuellement en situation de pauvreté pour avoir le point de départ? Et est-ce que vous pourriez transformer ce 56 points de pourcentage d'augmentation en pourcentage compréhensible pour nos lecteurs? Je vous remercie. Vous m'entendez?
Oui, peut-être Philippe?
C'est Florence.
C'est Florence, ok.
Florence. En fait, transformer ça en chiffres compréhensibles. Est-ce que ça vous aiderait de savoir la baisse de leurs revenus mensuels? Parce qu'en fait, ce qu'on a fait, c'est vraiment mesurer l'impact pendant un mois de crise du Covid-19. Et donc, on a aussi des mesures, et là, on pourrait, bon, je ne peux pas vous le donner maintenant d'un point de vue agrégé, ce que ça représenterait en termes de pertes absolues, en sachant qu'on mettrait dans une unité commune, pour l'ensemble des pays à bas revenus. Oh, sorry, I'm in French. I have to speak in English, you told me. Huh?
No, it's fine. No, whatever is better. What suits you, it's okay.
Ok. Oui, pour l'ensemble des pays à bas revenus et revenus intermédiaires bas. Est-ce que quand, par exemple, si je vous dis, par exemple, le revenu moyen a baissé dans les pays à bas revenus et à revenu moyen bas de 81%. Ça vous parle plus ou pas? Ça veut dire que la valeur totale pour ce groupe de pays des revenus obtenus par les travailleurs de l'économie informelle ont baissé ou baisseraient de 80% en raison des mesures de lockdown et en compte tenu des secteurs dans lesquels ils travaillent en raison de la crise.
Et là, le nombre de pauvres était...
Oui, non, le nombre de pauvres, mais ça, le nombre de pauvres, oui. Dans ce cas, je vous enverrai. Est-ce que je peux vous envoyer le nombre de pauvres après?
Okay. Has that answered
Ou
your
alors
question?
avant la fin, mais je le calcule rapidement.
Okay. I think that's answered the question. I hope so. But and yes, if you need a follow up, please kind of contact me afterwards. I'm not quite sure whether happy with that. So we have 4 more questions, and we'll just quickly go to Kyodo News.
Yes, thank you. Kyodo News, Lionel Faton. I had actually many questions, but we don't have time, so I will limit to one. I was wondering about the sex industry. I mean, I will tend to think that amid COVID, these people are particularly at risk in terms of health, but also will be heavily impacted because of all this issue of social distancing that is, of course, because of the nature of the job, pretty difficult to respect. So I was wondering, what is the impact of the COVID crisis on these sectors, especially the prostitution? Maybe if I can have a point of view of developing countries, and typically I was thinking about Nuno, and maybe the developed countries too, because I will tend to think that maybe the sex workers will be more and more going into the informal or underground sector in Europe, for example, to work. Thank you.
Nuno, are you able to answer that?
Yeah, it's not very easy. I mean, I don't have any data, specific data. I mean, it's more from anecdotal and some discussions actually with the government of Thailand 2 days ago. I mean, it's one of their concerns indeed. It's one of the areas they are worried, and they are worried that, for instance, they might not even be taken in this first round of the informal workers because of the specificities and the eligibility criteria that are in place. They are even more excluded than the groups that are already excluded from benefits. But actually they were concerned and thinking about a specific measure for this because they know, and they also want to protect people from needing to go to the streets. But I mean, in terms of numbers of it's very difficult for me. It's not sort of analysis we did for the moment, but I think you asked me because of the fact that I'm based in Thailand, and it's indeed something that came into discussion with the government at very high level some days ago. It's one of the areas that they are concerned because they had a big loss, of course, in terms of income. I mean, not only social distancing, there is a curfew in Thailand after 10 p.m. Of course, it's not only, it's all the industry of entertainment too. And then, of course, if you don't have tourists, you also have a big loss in all these sectors. Then, yeah, it's indeed something that's a concern. And then and when we then think on some of you mentioned earlier, taking even more risks, that's what happens if the income of this group of workers will even go down. Probably they will have to take more risks and to be even less protected than what they are already usually. But it's a very interesting question and something that we probably need even to think more.
Thank you, Nuno. We'll go now to Gabriela Sotomayor from Mexico, represents Proceso.
Thank you very much. Very nice to see you. So if you can comment on Mexico, especially millions of domestic workers who are heads of households, and the government said it was going to ratify the Convention 189, but I think the procedure needs to be completed. So if you can comment on the situation in Mexico. And then very quickly, your press release says that we have, I mean, it's not a question of choosing between, hunger and contagion, but while a vaccine or medicine is not found, do you think that countries, governments, employers, workers should take all possible measures to avoid lockdowns, confinements? Because it seems that the remedy is worse than the disease. What are your comments on this? Thank you very much.
I'd like to answer briefly on the Mexico question with respect to domestic workers. It's true. I mean, like in most countries, domestic work in Mexico is largely informal. So they have definitely been affected by job loss and loss of income. And they have also been doing a lot of work through the trade unions, again, to raise awareness among domestic workers and employers about that need to be taken. And I think that there's also a small employers association that has been helping try to do awareness raising and outreach to employers to help raise the sensitivities to the situation that domestic workers are facing in the country. Mexico did indeed approve the ratification of Convention 189, and the procedures are indeed still pending, which is why it does not yet appear on the official ILO website tracking the ratifications of Convention 189.
If I may add something on the situation in Mexico, I think Mexico is a clear example of what we've seen in other countries, and particularly in Latin America. Mexico has a relatively low unemployment rate. We are talking about an unemployment rate of 4%. I'm coming from Spain, a country where we have an unemployment rate over 15%. But then informality in the country is over 50%, what it means that people in Mexico cannot afford not having a job. And this is very clear in the country. And then what we observe is that in the country, the government has implemented two main policies. The first one relates to credits to small and medium-sized firms, and also to on-account workers. And the second important measure was taken in Mexico City, and it relates to the extending of the unemployment insurance. But it was, I mean, the unemployment insurance was extending in terms of horizontal coverage, let's say, so in terms of the people who can access to this insurance, but to be able to finance this measure, they decrease the number of months that people can receive these social protections, or this unemployment insurance. And I think here it's important to take into account two questions. And the first one relates to how these measures are able to cover all workers in facing a situation of lack of income right now. So how these measures are able to cover all informal workers in the country. And I think they are excluding an important share of the population because, for instance, domestic workers cannot access to these policies. They cannot access to these credits. They are not eligible for these credits, and they are not eligible for the unemployment insurance either. And then we also need to think that the unemployment in Mexico is the only country in the region that they don't have unemployment insurance in the whole country. They only have it in Mexico City. And the fact that the measure included more workers, but it was due to the decrease in the number of months that people can receive the measure, made us think that, I mean, what it will happen once these 2 months, so I mean, people now are entitled to this insurance for a few months, what will happen after? And we are thinking of a crisis that will be long lasting. So I think these are two important issues that we should take into account in the context of Mexico.
Thank you, Elva. We'll turn now to Maya Plentz. Maya, your question?
Yes, thank you. I'm muted now. My question is regarding, it's for Mr. Nuno Cunha, and perhaps also Claire and Florence could comment. It is regarding the informal economy, and how do you see that this crisis perhaps an opportunity for governments in the developing world to look at the issue of a universal basic income as a way of keeping the informal economy booming and working and being part of the formal economy, and also that this crisis perhaps also an opportunity to push forth the objectives of the WHO of having universal health care for everyone, everywhere. That's my question. Your comments.
Thank you. It's not very easy to comment when it comes to UBI, because I mean there are so many different approaches when it comes to UBI. It means so many different things, and there are different almost schools of thoughts within UBI. But what we have been seeing indeed, and we saw it discussions in moving ahead as they never moved before, on indeed the need for universal social protection. I mean, through UBI, through universal pensions, through universal healthcare, universal child grants. I mean, all these has been in the table. I think it's a moment, as I said, I think it's a moment that gives visibility to the topic, gives visibility to the uncovered that many times are not visible for those who take the decisions, even for some of the general public that don't understand when we are talking about informal workers, even in countries with high share of informal work. And today, I think it's more clear for everyone what it means, and the fact that these people not being protected, it's indeed like a risk for everyone. For instance, when I see some of the measures that were taken in some countries, and I think Elva was mentioning about the fact that they are not covered by unemployment insurance. And I think the reaction of, for instance, countries providing benefits specifically to groups on the informal economy is also the understanding of the importance for social cohesion. If we think about urban, the big urban settlements in Asia, for instance, where you have a large share of the population working in the informal economy, you know that this might be a risk for social cohesion, for social unrest. And that by taking, and this can be another risk for business, another risk for the economy. This morning I had a webinar more than 12 hours ago with our employers in Fiji. And one of the elements of concern is, of course, if we have already the COVID crisis, if we don't protect our informal workers, we might have also some social unrest, and this might lead to even deepening more our economic crisis. And I think it's a moment to understand that universal social protection is needed, and countries cannot afford it if they want to move ahead and to solve the problem that they have this moment in terms of crisis. I hope I answered to it.
Okay, thank you, Nuno. We now have a question from Catherine Fiancan-Bokonga.
Yes, I'm back. Listen, I have a question about the informal sector in developed countries. We see that a lot of migrants that were hidden in the society because they were working in restaurants or prostitution or other sectors are now coming out because they don't have any income anymore, usually because the borders are closed. They are unable to go back to their country of origin. So could you give us a little bit more infos on and data about these people? We've seen that in Geneva recently.
Okay, which one of our experts is able to answer that question?
Well, about data, Florence, myself, I can speak about informality.
Yes, go ahead. Yeah.
So in developed economies, a large share of informal economy take place in formal enterprise or household, because informality is very high among domestic workers, in particular in Europe, and migrant domestic workers even more. And this is part of what you are describing. So what is happening today? And again, we have no data, because first, these people are what we call, the European call undeclared work, means there are people that are working in enterprise that are declared, but themselves they are not declared. So effectively, when you have a pressure on costs for the enterprise, they are the most easily people you can dismiss because you have not any procedure, not indemnity or any kind of things of that. So they are probably, even if we have no statistic, everybody, and I had a discussion 2 days ago with a platform on a European platform, they are probably the most affected in terms of loss of jobs. They have no unemployment, they are not covered by partial employment or work sharing system, so they are probably the most affected. We also anticipate that another behavior may be for enterprise that have to use people to begin to recruit them by not declaring them to reduce the cost. So the anticipation is also that undeclared work will increase probably in developed economy. And in some countries, for example, myself, I work in Greece, it is 1/3 of the workforce. Huh? So we are not speaking about little number, 1/3, one worker among 3, more or less.
Thank you very much, Philippe. Yeah, we have just 2 more questions and then we'll have to wrap up. But the first one is going back to Agnes Pedrero because she had some technical issues with her mic. So she wanted to follow up on the questions that she had asked. So she just wanted some clarification on how many of the 2 billion informal workers were poor before the pandemic. And then the second part, so it refers again to the 56 percentage points. You know, can you translate that in terms that people actually understand what that actually means? And I don't know whether it can be perhaps explained in terms of how much money people have per day and how much that's gone down. So perhaps either Florence or Philippe.
Yeah. So in terms of malaria, we can come to a number. Actually, yeah, it's too small for me. Before the crisis, as part of the 2 billion workers in the informal economy, I don't 2 billion, sorry. You have 25, actually, before the crisis, 25% of them were poor, were estimated as relatively poor. As I said in the beginning, it's not absolute poverty, because this makes also a difference. So that means that you have 1/4 of those 2 billions that were considered as poor. After the crisis, this proportion of poor rise up to 60%. So that means that the 2 billion workers that you have not anymore 1/4, but 60%. So 60 of 2 billion, that's why I was trying to do quickly. So it would be 1.2 billion. And to answer to your question before of the 56% in low and lower middle income countries, actually in those group of countries, the 2 low and lower middle income countries, is where you have the largest countries with informal employment. That means Bangladesh, India, Indonesia. And initially, just if I'm going back, how the changes in poverty make that you have an additional almost 700 million informal economic workers that would become relatively poor. And I also insist on the fact that we are talking about relative poverty, but that means that what we come to is almost 700 million additional poor in those countries. And just to know that in those 2 groups of countries, you have 1.2 billion, a little more than 1.2 billion informal economy workers out of the 2 billion. It's really the countries where you have the most.
Thank you very much, Florence. And now I'll just take the last question, and it's Gabriela Sotomayor again. Final question.
Answer my question on lockdowns, and I mean, because is that the solution? I mean, I know the health is so important, but maybe we should be more creative. I mean, to avoid that, because this is hurting a lot of people. So just your opinion on that. Thank you.
Maybe I will respond myself. So ourselves, I must say, as ILO specialists, we have no valid expertise in this area. So we have seen that In some countries, in Europe, for example, they didn't adopt full lockdown measures. There is a debate in Europe about that, but ourselves, the ILO had no capacity to speak about that because it's first a WHO issue in the UN system to recommend the type of measure to prevent the spread of the virus. What is sure, as I said before, is that if you want to implement lockdown measure where you have large informal economy workers that have, most of them are poor, have no money, etc. If you don't provide them some income support, this will be very, very challenging to implement. And it is very challenging to implement. It's why you saw some countries are reluctant to do it because they know that, for example, personally, I was surprised to see that India took the decision. Because when you are in Delhi, you have 26 million, or I don't know how many, but something like that in the city. People living at 6, 7 by room. I mean, but this is what happened. This is what I can say. Really, we are not well placed to respond to this question.
Thank you very much, Philippe. And we'll wrap it up there. And thank you, everybody, for taking part in this virtual press briefing on the informal economy. And thanks to our participants, Florence Bonnet, Claire Hobden, Nuno Cunha, Ana Maria Chiaga, and Elva Morello. If you do have any further questions, you can email us, myself, yard@ilo.org, or newsroom@ilo.org, and we'll try and help you as best we can. So thank you very much and have a good rest of afternoon. Bye-bye.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everybody.
Thank you.